Yeah, good day, YouTube. Been a long week. So let's start out Monday. Normal hospital visit, blood draw, COVID test. Still got an issue with both of them. But I just pull out my patient portal on my phone and just point my finger at what I want. So we did do that, and so got checked in, and then we go over to the lab. Got to do it all over again. Point my finger, this and this, Tried to get them to take these old tests off that are non-existent. Actually, some of those I've taken twice just to try to appease them to get them off the system, and it didn't work. So all's good. Tuesday. Went down, got my peritonitis. Wasn't too bad. Only got 3.5 liters off of me. I knew there wasn't much in there, which is still a lot, but they pulled that out of me. And the way the new order for the peritonitis is set up is I don't get the albumin infusion until they pull 5 or more liters off of me. So I didn't get the infusion. I did get the phlebotomy. Just 1 point shy of not getting that. So I got that done. So we actually got out of there a little bit earlier than what we expected. And that was good. Came home, chilled. Probably watched some more Shameless. But Wednesday, we had to go inland to Bedford. So I get up Wednesday morning and yada yada. And so it's getting right close time and we need to take off. And so I get a letter through my patient portal with Oregon State Science University. And so I'm looking at that, and I'm not a candidate yet for the transplant. And I already pretty much knew that. But they confirmed it to the hepatologist who is on the transplant team. Different than the hematologist. For you that don't know, I didn't know there was, two like that. Hepatologist, hematologist. So the letter says, gives me my end-of-life score, which I knew was low. And that's a good thing. 10, they confirmed it was 10. And so I got that letter, and they're like, we invite you to come up, talk to a hepatologist anyways, and come hang out with them for a couple hours, and we'll talk about, future treatments, current treatments, stuff like that. And so we head over to Medford. Takes us about 3 hours. And get over there, we get to my appointment. Hang on a second, the dog's barking. Sorry about that, some rude guy walked by and just let his dog crap in my yard. But, so we get, lay down and behave. So we get over there, and my gastrologist, she already has the letter as well. And she's read it. And so we discuss it, And she's happy as well, with the MELD score of 10. And so then we go ahead and go into the appointment, farther in. So we have a list of questions and great big binder just full of stuff that we keep. I can show you, hang on. So this is our binder we have so far, and not everything's in here, but there's a lot, So we keep this big binder, all pertinent information on me. we get to talking to the doctor. So the first question, which seems simple and basic, but it's one that I've never had a doctor be able to answer me. And it's, what is a low sodium diet? And it's like, y'all keep telling me stay on a low sodium diet, but no one's told me what a low sodium diet is. What exactly does that mean? And she's like, well, that's simple. Just try to stay under 2,000 milligrams of sodium a day. And I'm like, well, that's simple. I normally don't even eat that much salt, have that much sodium in my system. And so on to the next question, what has to do with sodium? And we've asked my primary care over here to explain it to us. It's like, we don't understand. You're giving me 2,000 milligrams a day of sodium to start the day off with. And then you tell me to stay on a low sodium diet. And we're saying, this just doesn't make sense to us. Maybe we're just stupid country folk. I don't know. But it doesn't make sense to pump me full of sodium and then on the way out the door tell me, stay on a low sodium diet. And so we say that, we tell my GI that, and she gives us this weird monkey look. That's what I called it. Like, what the hell are you talking about look, And it's like, well, she's, this is what she's giving me over there. And so she's looking through her paperwork, and she doesn't have anything since March 1. And so she's like, well, yada yada, and my wife's like, well, I've got all this information in our handy dandy folder. And she's like, well, can I see it? And we're like, yeah. And it's like, which brings up another question for later. And she's like, oh my goodness. She's like, I don't understand this at all. And she's like, stop immediately taking any sodium supplement tablets. Stop that immediately. It's like, all right, no problem. It's like, she never could understand. And so we get into other questions. Another one is two of my other medications. And so here a couple weeks ago, I got bored at nighttime. I read about this stuff. So I was reading about my medications, exactly what's this one do, what's it used for, where does the dosing start, for this and that. And so every time I search one, which would be, I think, the Hemochromatosis, I don't know. Those two are hard to pronounce. The other one would show up with it to take it in conjunction. So you take two of them. Basically, they're a Lasix and a diuretic, but which can really help with the ascites. And so, I keep reading more about it, and I'm looking at the dosage. Hang on, I gotta pause again. So I'm looking up the dosage on those two. And she started me off, one of them at 25 milligrams a day and the other at 20. And I really searched a lot, and I couldn't find anywhere where the dosage should be that low. What I was coming up with was the one should have started out 100 milligrams a day and the other 80 milligrams a day. So that's what I kept coming up with. And I'm talking about, I'm getting on the Mayo Clinic's website, manufacturers, So anyways, we go to talk about that. And she's like, huh? So I get that weird monkey look face from her again, like, what the hell are you talking about? And she's like, let me see your charts again that we have. And so we show her and get another weird monkey face look. And she's like, has this dose ever increased? We tell her no, it's been this way since January. Another weird monkey face. She's like, I don't understand. She's like, you've never been at this higher dose. This is for like prenatal dose, And so she looks it over. She's like, I don't get this at all. And so she jumped those up, one to 100 milligrams and the other to 80 to start with. And you can get these all the way up to 400 milligrams, but they go in steps, but they have to work in conjunction with each other, and you step them both up at the same time. And so she changed that on me, changed that order, and Friday they'll pull blood. She'll look at it and make sure my electrolytes and everything aren't doing funky stuff. And if they're not, then she'll increase more. And hopefully eliminate the ascites crap. Ascites. So, which we did talk about. And I talked to her about, if I'm a candidate for the tip procedure. She's like, well, you are a candidate for it. And we're not against it. And we do them. She's like, but you haven't been given even the right medication to see if this is where you need to be right now. Because we don't know if we can control it with your medication. And another one of the medications was vitamin B1. She's like, chuck that crap. She's like, what do you eat? So I just randomly tell her what my normal daily diet is. She's like, you already have excess B1, which is okay to have. We just excrete it, we only use what our body needs, and then it just expels the rest. And she's like, well, toss that stuff out. So she's like, this is all coming from your primary care. I'm like, yeah. And we talked about, getting all my records, from my labs and stuff, and she thought I was doing okay over here. And I told her, I was like, I'm pulling labs once a week. She's like, huh? I'm like, yes, you're not getting none of this? Nope, none of it. I'm like, you're kidding me. I thought this was all being shot over you. You are the specialist, and not getting none of it. So the ascites, we talked about that, and she thought that was kind of under control. She's like, I haven't really heard anything from your primary. It seems, it's under control. I'm like, lady, I'm getting that done once a week. And she's like, the hell are you on about? Again, and it's like once a week. And she's like, well, how come? Well, obviously, I got to get it once a week. I'm averaging probably 5.5 liters a week, probably is what on the average. They've taken out 130 gallons of fluid out of my stomach, abdomen, peritoneal cavity, to be correct. So she's just all confused, and she doesn't get it. And so she's kind of pissed. You can tell that. And she told us, she's like, anything that your primary care physician tells you from now on that has anything to do with anything that's going on with you and what I'm treating you for, do not do it until you call me and personally talk to me. It's like, all right, that's what we'll do. And so she's like, asked the wife, do you got enough of these where you can start tonight? Upping these dosages, because we have a prescription for a much smaller dose. And so we do, and so she's like, all right, great. She's like, I'm going to call your PCP by the end of the day tomorrow, which was yesterday, Thursday. And I'm going to tell them, and they're going to write you new scripts, and they're going to know that I've chucked your sodium pills. This makes absolutely no sense, and you don't know what you're treating if this is what you're prescribing. And I'm going to chuck you B1 because they don't know. And we're going to up these other two because they don't know. So basically, I'm like, so they really don't know anything. And she just looked at me. I understand they can't just bash doctors, but by golly, some of this stuff's kind of basic, and I'm finding it out on my own. And that's what the sad part is, if we weren't proactive, we would just totally be clueless about all of this. And she profusely thanked us for keeping these binders, and we'll keep them. It documentates everything. The only thing I don't have in the binder is some medical records from Sutter Coast of exactly everything. It's 390 pages. But you can read through everything they've said and everything they've done. You can see where they lie to you, where they don't. Some interesting stuff I come across in there. They knew how long I was going to be in ICU within the first 30 minutes of me going to ICU. It's like, how did you determine this number of days? And the only thing coming to my head is insurance, because technically, I was there 4 days, technically. I could have got out on the third, no problem. I wasn't even hooked up to anything. I'm just walking around up there bored. Not even an IV, no nothings, And some other stuff they lied about. It's easy to catch, So it was a good visit. Trying to think what else we talked about. Medications was the main thing. Might change some around, I'm not sure. Might add some more yet. I'll go back up and have a recheck on my upper GI again. They did ban one blood vessel the first time in, and there's a couple other blood vessels in there that are kind of iffy, but she didn't ban them. I can't remember the name, what that's called, but it comes from the portal pressure. It's the same thing that forces the ascites out. It's forcing that portal pressure up into your esophagus, and those veins can burst, and which isn't a good thing at all. And so I'll get a checkup then, and I'll start seeing her every 3 months personally in her office now, and go from there. We are going to get that referral to see the hepatologist and go talk to him and just get information and stuff like that. So for now, I just still live feeling like a turd. As far as this part is, and hopefully we'll get straightened out some more here with what she's done. She never got anything from my hepatologist down here on my hemochromatosis, and she was got another weird monkey face look from her. She's like, "What the heck," And she's like, when did you find this out? And of course we've got the records, and I've got the report from Quest Diagnostic and all that happy stuff, and she reads through it and everything. And she's gonna touch base with my hepatologist. The hemochromatosis is not her forte. That's a blood disease, and the other stuff isn't a blood disease. It's the aftermath, the effects of. So didn't do anything yesterday, and laid around. Like I said, it was a long drive. I did stop and get my Abby's pizza, for you wondering. and I'm sitting here. It's lunchtime for the wife. She comes home. She mentions one of our friends' name and says he got really sick Monday and doubled over in pain and whatnot. And so they got him in the emergency room, and they're like, "Dude, your pancreas is screwed." So Tuesday, they're on the phone, obviously, and they didn't get anything done on Tuesday. Wednesday, they make it to a VA clinic for him, and they're like, you have this big lesion on your liver, you have a tumor on your pancreas, and it's you got some bad lymph nodes. And they're like, yada yada, we're gonna pull biopsy and a PET scan. And so they do those things, and yesterday, and wife texted me this morning, stage 4, unoperable. This all went down in 4 days. 4 days time. And there was nothing wrong with him until Monday. He just crumpled over in pain, and I did do a little brief reading. Usually by the time they know something's wrong like that, it's already done spread everywhere. So it's metastasized to his liver, his lymph nodes, and man, what a way to end the week, We probably won't know anything else till after the weekend, but what the plan is, but the outcome is short-lived, very short-lived. So, that's my wife's best friend's husband. So she's having a crappy day at work. My appointment went all right. We were happy with it, to turn around and come home to this. But I guess, that's life. And sad, that's for sure. Don't have a whole lot more to say. Just spent a lot of time on the road. And I think we're going to call my PCP. We're supposed to call him tonight. Probably call him by 4:30, I'm sure. And see if they've called in the new prescriptions. She's probably going to crap her pants. But the first time we asked her to explain this sodium and low sodium, it was like witchcraft fuckery coming out of her mouth, and it's just like didn't set good on me at all. I'm like, I don't understand anything you're saying. You tell me you have to give me the sodium, but yet you don't want me to have sodium in the same breath, low sodium. And I don't know. I knew something was amiss there, and that was very concerning to my gastrologist. She couldn't think of one reason why I'd be taking sodium supplement tabs. She couldn't come up with one reason why. So that should tell you something. I got an appointment coming up yet with this other primary care physician. I think it's around the 18th of July. And we'll go in there and talk, and see what this guy's about. See what his PA is about, See if they're capable of writing an order for a COVID test. See where they stand on this low dose pain pills for the hemochromatosis. I need that. It comes and it goes. This last time around at the phlebotomy, about a day and a half afterwards, my muscles and joints, really subsided in pain. But, and then it comes back, and it's back now. But still managing it, not even taking the recommended amount of pain medication. So, just sucking it up. But so we'll see him on the 18th, like I said, and just have a chit chat with him, and probably fire my other one. It's just, I'm just like, you have no idea what you're even doing for me. You're just throwing pills at me, without knowing. And I have a GI, and you're not conferring with her. You're not sending her any paperwork. You're not sending her any lab work. Nothing. That's not good in my book. So that's where we stand. Blood work on Friday. Mainly they're going to be checking for electrolyte shift. But I don't have a problem with that. They were checking me, I think once a week when I first started the peritonitis. They were checking me once a week on that, and no numbers ever changed. And they just look at that once a month now for peritoneum. You know, they take a bunch of fluid out of your body. It can do bad things to you. You know, heart attack even, and stuff like that. But hasn't been an issue, so hopefully these Lasix and diuretics won't cause a problem. I don't see them doing that, and hopefully it'll help some. You know, if they could just stretch out my peritonitis, you know, longer than 7 days, that would be great. We're going for 8 days again this time, so I won't be in until Wednesday to get drained. See how much they pull off. It'll be interesting. I'm not sure why there wasn't that much in me the other day. It's good to see, that's for sure. 3.5. I've only got, out of 22 times, only twice has it been down to 3.5. And you know, if it stays the same, that's good. As long as I can, the longer I can stay away from the TIPS procedure, the better off I am as well. But that option is there, and I was glad to hear her being receptive of it, and they do them, and yes, I am a candidate for that, which would help even more. But we're going to try this route first and give it some time. Probably know, you know, a couple weeks what's going on, and with the fluid. If they could, you know, get that under control, I know I'll feel better. That's for sure. And then just dealing with this joint pain and muscle pain. And that's it. Looks like just about up to my 30 minutes where I try to keep these. I don't have anything else to say. And I'll just keep hoping for good things, you know. Hope my end of life score stays low at 10, which is really good. She kind of implied where, you know, I think she was kind of reading me, but because I didn't ask her, but she's like, you know, Mr. Bay, I think there's more of your liver that's actually still good and working than what you probably think there is. And you think it's worse probably because of the way you feel every day. You know, so that was kind of encouraging. She picked that up on me somehow. I didn't bring it up, but she did. You know, that'd be really nice, you know. She told me she gets patients that make it 10 years. Some 1 year, some 2 years. And she scheduled me out a year. I did talk to her about the PET test to make sure the order was right. I think I told you they changed the order on that, and nobody was really sure. It was no biggie because I had the appointment. And so we asked about it. It's like, can you, you know, yeah, whatever word I'm looking for, elaborate on the order. And it's like, are we understanding it right? You want me to take the PET test once a month now? And she's like, yep. I'm like, all right, I'm just making sure, because one of the requirements before you can even get a transplant is to have this for 6 months. They have certain things you have to do before they even really start treating you up there. And so far now I've done everything, all their pre-transplant requirements I've done. And so she said, do that once a month for 2 months, and then I won't check you again for a year. And it's like, all right, sounds good. I just want to make sure it's right, you know, check me however often you think it's needed. But I kind of got the understanding is a lot of her patients, you know, they don't pass these very long, you know. They just can't do it. So she was really happy, and that's why she did that. She doesn't have any worries. I don't have any worries, I can tell you that. But we'll leave it at that. Wednesday next week I get drained. I can't really see anything happening before then. So probably not a lot to report on. So I guess it'd be Wednesday. Thursday probably put a video out and update you on Wednesday. Till then, you guys stay healthy out there and stay safe, man. Peace.
Make family-sized meals. Bonus number 2, the crisper basket.